I think after everything that I've walked through over the last 5 years, I think I've really learned that, you know, there's no giving up. You may walk a incredibly difficult path, and at the end of the day, you just got to keep fighting. And I know that is such a cliche, thing to say, but you do. I remember specifically being in the ICU and just being really tired and just done with fighting. And specifically, my brother came in one day and he said, "You got to get up. This is not where your story ends. You got to get up. We got work to do. We are going to make it through this one way or another." And I think to me, that was something that I needed.
Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, I have Danielle Ford here. Hi, Danielle.
Hi, Sarah. Thank you for having me.
Yeah, I'm excited that you're here. Danielle's going to share her story that has been very challenging, but with some really impactful people that have helped her through it. Danielle, do you want to start your story where you think it should be started?
Well, it starts way back in 2019. I was actually diagnosed with multiple sclerosis. And at that time, my doctor, my neurologist, discussed with me the different treatment options I had. And one of them was a high DMT, which is a disease-modifying drug. People that don't know MS, it's a progressive neurological disease, so there's no cure for it. But there's a lot of different things out there that can help slow it down. So I ended up taking a very popular high DMT, and it worked for a lot of years, but it suppressed my immune system. And in April of last year, I ended up getting just a run-of-the-mill infection that I didn't realize I had. And it quickly turned bad, and it landed me in the ICU for 97 days. And I had 12 surgeries within a little over 2 weeks to save my life. And I ended up, not being able to eat and being fed through a IV for, I want to say over 2 months. I wasn't able to actually eat anything, and I had a lot of open wounds. I ended up with a permanent colostomy from it, and it was a experience for sure. I left on a girls' weekend, and I didn't come back for 3 months. So it was definitely a struggle, and it was because of the DMT that I was taking for my MS. Just my immune system could not handle the infection. But thankfully, I ended up with a surgeon, a colorectal surgeon, Dr. Main, here in Columbus. He saved my life. He pretty much put off all of his other duties for the 2 weeks time and did multiple hours on hours of research to try and figure out different things that he could do to try and save me. Because it was not looking very well at all.
Yeah.
It got down to my last surgery, and if they wouldn't have got what they needed to, there wouldn't have been anything they could have done. So I definitely attest him and his dedication to trying to keep me on this earth to, surviving.
Yeah. And I'm thinking about you there in the ICU for 97 days. And I'm, curious, what were some of the things that were done there for you by your family, friends, the hospital staff that helped you make it through 97 days in the ICU?
Yeah, Grant Medical Center here in Columbus, they are wonderful. My nurses were amazing. I don't remember probably first month, maybe 6 weeks was, about the point where I really started remembering what exactly was going on. But I have a wonderful support system. My parents spent every day with me. So 97 days of them every day, 8 hours a day with me. My sibling, my brother, my husband, his family. I had an army of people. I was getting letters and cards from churches all around Ohio that were saying they were praying for me and that, they were wanting to make sure I was getting better and things like that. Dr. Main, of course, was amazing. He spent a lot of his time before the rounds in the morning. They always came around at like 7 a.m., but he would always pop in earlier and he would just pull up a chair next to me and sit down and he'd be like, what do you want to talk about today? Are you doing okay? How are you doing? And he also pushed me. There was times where, of course you're in the ICU, you're tired, you're on a lot of medication. I was bedridden, so I wasn't able to walk for those 3 months. And he really pushed me to get up and participate in physical therapy and make sure I kept going. So I really developed a really great relationship with him. Like I said, I didn't remember the first 6 weeks, but I've been able to kind of piece it together with asking my family and friends that were there with me through it all. And not only did Dr. Main have my respect, but he has everyone within my circle's respect. They said he did everything he could. He barely slept. He tried all these different things. He did all the research. He watched my vitals. He really managed to really see something in me that, not knowing me off the street to really helping me, stay alive. And that's a debt I can never, repay to him. And even now, I still talk to him. It was very overwhelming to wake up and not know where you're at. And I had open wounds for months, and not being able to get up and move and all those other things was incredibly scary. And to see the same four walls over and over again. But like I said, my nurses were amazing. They would come in and check on me multiple times. There was a time where they got like a wheelchair type thing where they could actually transfer me over to it. And they would take me outside the hospital because Dr. Main said that I needed to see the sun and that I needed to see things around me. So they did that. Everyone was super nice and very kind and understanding and let me ask questions. And they treated me like a person and like I wasn't more than just a patient. So I can't say anything but wonderful things about, the ICU at Grant. Nurses, doctors, best people ever. And like I said, my family, was there every day. I had a wonderful support system, so it was very easy for me not to give up because there was a lot of people there that were consistently telling me that, you had to keep going.
Yeah. That's so beautiful. To have that kind of support and to have a doctor who is so dedicated to you and beyond just doing the medical, things that he did to save your life, but to come in and sit with you and check on how you were doing, like emotionally.
Yeah,
That's so
emotionally, he always, and even once I got out of the hospital, I still had to, check in with him every couple of weeks, but he would request that I would, message him. We have a thing here called My Chart. I don't know if that's nationally or not, but he would be like, I need you to check in once a week. Tell me what you're doing. Tell me what you're up to. How are you doing in physical therapy? Are you back to work? What are you doing? Like, he consistently made sure that I was okay. And him and I are relatively close in age. He's a little bit older than I am, but my parents told me that when I really was sick and he was, in the thick of things, that he told him that, I'm only 34 years old, that he couldn't let me just go without a fight. So he definitely, is an angel in my book. He definitely saved my life for sure. So
yeah, that's really beautiful. And are you still in contact with him? Do you still update him through your chart?
oh yeah, I seen him last week actually. So yeah, him and I, we have a great relationship. He has a great relationship with my family. It's actually funny because now that I go into his office, they have like one large exam room and they always reserve that one for me because my family always wants to come with me. Like, they have to take numbers, like, and who gets to go to what appointment with me because they just want to check in and see how Dr. Main's doing. So he not only, has my respect, but he has so many people in my life's respect. And that's something that you do not find in these times. And, doctors treat you like a number and not like a human. And he went above and beyond to make sure that, one, that I lived, and two, that my mental health was okay.
Yeah, I want to take a pause there because I think that what you said is so important, because there are people who've had challenging experiences with doctors and nurses, and then there are a lot of doctors like Dr. Main, right? Really wonderful human beings who show up and see their patients as human beings, and they're looking at like the whole picture of what's going on in the body, how is this person doing emotionally. And I think that's so beautiful that you've had that experience, especially when you were at this place where you were your most vulnerable.
Mm-hmm. Yep, for
Yeah.
sure. It's definitely a different experience when you walk into a hospital and you wake up 6 weeks later and you don't know what happened to you. And just to have a person that is willing to go over, the norm and sit down with you and, look at you as a human and be like, hey, you're 34. You got to get up and you got to get out of here. And he never let anything happen to me. There was things where they wanted to transfer me early to a rehab facility so I could learn how to walk again and everything like that. And he was like, no, she's not ready. I want her here a couple more days until I know for sure she's good to go. And then we'll transfer her to the next step. But he definitely, did what he had to make sure that I was okay. And we would laugh. Like there would be times like he would ask me, different stuff. We had a thing when I was really sick. He would play music sometimes when he came in the room to see me, and he was like, "What do you want to listen to today?" And I was like, I'm a 90s kid. So I was like, you know what? I love NSYNC. And he was like, I have no idea who that is, but we'll look it up. And so he would play NSYNC when he would come in and do the wound cleanings and stuff that I had to do every day. And he printed me out a poster of them actually and put them in my hospital room. And I
That's
still
awesome.
have it. I still have it. I
Yeah.
put it in a scrapbook. He was like, just so you can look at them every day, I printed this off for you, and I'm just going to put it up here in your room so you don't forget. And I was like, okay, Dr. May, whatever you say.
Wow.
Him and
Yeah.
I, we definitely bonded for sure.
Yeah. And again, I keep going back to the fact that, like, you know, when someone is in their most vulnerable kind of place where, you don't have much control over things and you're in pain, to have somebody who shows up like that, who is so kind, but also really thoughtful and brings in music, which can be so healing, and then printed out an NSYNC poster. I mean,
Yeah, you can't beat that. I mean, it definitely made my day. Made it a little bit easier looking at, NSYNC every day and just to
yeah,
laugh. And, it was an inside joke between us. So, yeah,
yeah,
he definitely is one of a kind for sure. And I'm so incredibly fortunate that he was on call that day that I went in.
yeah. Wow, that's beautiful. The thing that I'm wondering about is what your journey's been like since you left the hospital, coming back into your back to the life that you left and went, spent 97 days away from in the ICU. What was that like?
It was definitely difficult at first. Like I said, I came out of the ICU after 97 days. I spent 2 weeks in an in-house rehab facility where they taught me how to walk again. When I left the rehab facility, I was in a wheelchair. I was not fully able to walk completely.
Yeah.
And I had a lot of struggles, but I went home. I ended up staying with my mom and dad because they live in a 1-floor condo, and mine and my husband's house is a 2-story. So I stayed with them for a couple weeks, and my aunt, she took care of me a lot through this whole situation. She came to live with us. So I had a whole group of people that were taking care of me 24/7 on top of everyone coming to visit me every day. I think I had a visitor every day for the 97 days I was in the ICU, plus every day after I got out, which I'm incredibly fortunate for because I know that there was people on that floor that never once got a visitor. And I definitely think it kept my spirits high.
Yeah.
But transitioning, back to your life it was difficult. It really was. And I didn't realize it at first,
Yes.
because I think I was kind of just dealing with coming off of, just being in the hospital for so long and looking at the same four walls for so many
Yes.
days. So trying to transition back to life, it was definitely difficult. Often, like, tell my family and friends and things like that. Like, I felt like I was living my life through like a window. I wasn't
Mm,
fully present in the life that I had had before, and it was difficult for me to jump back in to the
yeah.
situation that I had left. And I found that very difficult because when I left the hospital, I left obviously with a lot of mental scars, but I also had a lot of physical scars that I had to really learn to accept and to honor instead of seeing as a negative thing. So you have all this at once and trying to deal with it. It was incredibly difficult. My brother, um, he's 3 years older than I am, and him and I have a really close relationship. He was the one that really set me down a couple of weeks after I came home, and he was like, I honestly think you should go to therapy.
Yeah.
He's like, you definitely experienced something, that no one should have to go through. If you don't take care of it now, it's not going to get any better. And so I ended up doing a therapy, one-on-one therapy for a couple months after I got out of the hospital. And it really did help me kind of, evolve myself back into the life that I had and to learn that, things may be different, but that I still have a purpose and that I can find joy in this new situation if I just look hard enough. And that's something too I think my chronic illness has really taught me is when I first got diagnosed with multiple sclerosis, my neurologist was like, you need to mourn the loss of the person you thought you were. And it's not the fact that you can't be successful. It's just that you walked in here one person and you walked out here another person. And that's okay. But if you don't take the time to really sit with that and accept it, you're never going to be able to move on past that. And that was something that I really used in this situation as well, where I walked in that hospital one person and I walked out of the hospital as another. And if I
Yeah.
didn't learn how to accept that and learn that it's okay and it's nobody's fault, then I couldn't move forward, in my life. I would have been stuck. So therapy definitely helped me for sure.
The thing that I am so impressed by is that you had so many people in your circle of support that were thinking about your mental well-being.
Yeah, I definitely surround myself with all the right people. My family we're all really close. Like I said,
Yeah.
my brother and I are best friends. And so I had a lot of people, my best friend as well, she checked in with me consistently. I think I have a lot of people in my circle that kept me accountable. They didn't let me walk through this by myself and then just abandon me. Even after the times I was out of the hospital, whether that was my doctors, whether that was nurses that I had got a relationship with, my family, my husband's family, my friends, things like that. There is so many people that consistently, and still to this day, still consistently check in with me and are aware that if I do have a bad day or that I need time to regain confidence in this new life. No one pressured me to be who I was before I went into the hospital last year.
Yeah. That's really beautiful. A lot of, the people that I've talked to through this medical trauma work have not had their medical professionals encouraging them to seek mental health support. And you had that, but you also even had a medical professional sit with you and check in with you themselves on how your emotions, how your mental health was going. That is the dream, right? That's, I think, what I hope that our system can get to is understanding that there are huge impacts on our mental health when we go through something that's really, really challenging, like what you've been through.
For sure.
So yeah, that's amazing. Have you heard the phrase post-intensive care syndrome, PICS?
Hmm. Yep.
Yeah.
Yep.
So who told you about PICS?
My therapist actually
Okay.
did. Yeah,
Yeah.
so when I decided to look at the option of going to therapy, I had talked to my best friend about it, and again, my brother and some of the other family members, and Dr. Main, and he had suggested that I go to a trauma therapist specifically.
Mm-hmm. Yeah.
Which are very hard to find. I don't know if that's everywhere, but here in Columbus, they are very far and few between.
Yeah.
So I ended up finding a trauma specialist specifically as a therapist, and they opened a different way of thinking. Yes, the different perspectives.
Yes. Yeah.
It was definitely, I learned that I did have a little bit of PTSD because of all the things that I had, and that it's not, just black and white, grief and trauma and how you deal with things. It comes and goes, it flows. You could have good days and bad days and things like that.
Yeah. Yeah. And what do you know, what like different modalities that your trauma therapist used? Like, did you try EMDR, or what do you know what kind of interventions that your therapist used?
It's been a while since I ended up having to quit sooner than I thought because I relapsed with my multiple sclerosis and I couldn't talk more than like 10 minutes at a time without cutting out.
Yeah.
But we did go over, we were getting ready to approach that EDMR section. When I
Okay.
first started, she really focused on the PTSD part of it. And we were really handling, to begin with, my physical scars. I was having a lot of problems with how I looked
Mm-hmm.
because I have a lot of very large physical scars everywhere on my body. And when I came home, that was one of my triggers. I didn't look in the mirror for months after I came home because I just couldn't, handle it. Yeah, so my physical scars were definitely a trigger for me. My husband and I, we don't have kids, so I've never been pregnant or anything like that. So, you know, I I had all these new scars that to me were ugly. It I think as a woman, especially, at the age that I am, we put a lot of depth in how we look, even though no one around me could care less about those scars that I have because it's how I survived. It's a story to tell. To me, all I could see was just, I was defeated. I had lost about 30 to 40 pounds of the weight that I had when I went in. So when I came out, I was skin and bones and I looked so sick. And every time I looked at myself in the mirror with those scars, it would just cause me to have, a breakdown to a certain extent. I would just sit and cry because I couldn't understand, how to look at myself as someone that was confident and things like that. When I looked in the mirror afterwards, it was definitely a very triggering situation to where like I would turn all of our mirrors around in our house for the longest time.
Yeah.
So that was something that I really kind of focused on in therapy, was trying to love myself for who I am now. That those scars are not things to show as ugly. Those are stories of survival.
I'd love to talk a little bit more about that. And because, you're not the only person I've heard talk about that and how hard it is to see the scars or scar in the mirror, and how it can be really triggering it's like this daily reminder of what you've gone through. And I think, it sounds like you've gotten to a place where you see your scars very differently now, but it can be really hard for somebody who hasn't gotten to that place yet.
Yeah, and that's one of the things that my therapist really talked to me about was exposure therapy. The more you look at it and give yourself time to adjust to it, the easier I think you come to understand that there's still, beautiful pieces of you regardless. But it was so hard for me when I came home. That was one of my hardest things to kind of, come to terms with. Because not only did I have my scars, I also ended up with a permanent colostomy. And that is something that I would have never thought about ever. So having an ostomy was not something I had ever prepared for in my life. I literally woke up in the hospital and I had this new, situation going on, as well as with all these open wounds and things like that. And that in itself also was very hard to accept because, it's permanent. It's not something that is ever going to be reversible. And that was something that I really had to come to a conclusion with, which it saved my life. I am grateful for that. And I have learned so many different things about the ostomy community and how many people really do live very successful and productive and happy lives having ostomies. And it's something that, I really worked really hard on trying to educate myself with and learned the different, things out there that can help you, whether that, like I said, support groups. I joined a lot of Facebook groups, a lot of different communities where I could ask questions and feel comfortable with people who were like me.
Yeah. Yeah, the support piece is so huge, especially when something has shifted so much in such a short amount of time, to be able to be with other people who get it,
Mm-hmm.
who understand what that change is like. Because I think there are some situations that are hard for somebody else to understand if they haven't had that experience. And it's so beautiful to get all of the support from family and friends, but sometimes you want to be with somebody who gets it. They know what you're talking about because they've been there too. And so I think it's so beautiful that you have not only the support of your medical providers, you have the support of your family, your extended family, your friends, but that you've also gone and you found these other support options.
Yeah, I always like to say that, God may have chosen me to walk a hard path, but he gave me enough people around me to survive it.
Yeah, that's really beautiful. Thank you so much for being here and sharing your story. And I'm curious if through, these serious challenges, but also all this amazing support, if there was something, like a piece of wisdom or something that you learned along the path that you wanted to leave the audience with.
I think after everything that I've walked through over the last 5 years, I think I've really learned that, there's no giving up. You may walk a incredibly difficult path, and at the end of the day, you just got to keep fighting. And I know that is such a cliche, thing to say, because I know a lot of people that are probably, especially around me, but I've heard people say, people just say you got to keep going, but you do. I remember specifically being in the ICU and just being really tired and just done with fighting. And specifically, like, my brother came in one day and, he said, you got to get up. Like, this is not where your story ends. You got to get up. We got work to do. We are going to make it through this one way or another. And I think, to me, that was something that I needed, because even today, if I have bad days, if there are days that I don't feel confident or that I am sitting in my feelings, it's okay to feel anything you need to feel, but just don't stay there.
Yeah.
I think that's one of the things that have kept me going, is I have felt every feeling you probably can imagine.
Yeah.
But I've never stayed there, and I have accepted, the path that God has decided that I needed to walk. And I'm better for it. You know, I don't want to be chronically ill. MS is not something I wish on anybody. Going through
Yeah.
what I did is not something I would wish on anybody, but it made me stronger. And if that's the path I had to walk in order to tell a story and help somebody out there that may be going through something, then I would happily do it all over again.
Yeah. Yeah. And something that really stands out to me in our conversation is how faith has been a resource for you, being able to lean into your faith. And for a lot of people listening, it could be very different, words that they use for God, universe, but that I think that is a really common thing for people when they're in hard times is to really lean into their spiritual beliefs.
Yeah, no, I agree. Yeah, I was never, a very spiritual person, before last year. But when you are that close to the end, there's no better time than to start understanding, to be maybe a little bit more open to your faith and the different things that come with it. Like I said, I was getting, cards and notes and everything from so many different churches around, Ohio, even past Ohio,
Yeah.
with people just saying, "Hey, we're praying for you." There was prayer chains that were going out over social media, and there was a pastor that would come into my room and pray with me when I kind of woke up and kind of started really understanding where I was at. And even the hospital even gave you a support team that had a pastor, a social worker, and I think there was some other type of nurse that was on there. And they came and visited me probably every other day and just prayed with me and asked me, how I was doing. So again, back to, how you and I were talking about mental health and checking in with how you're doing and things like that. Like, they did a really good job. So I was not a faithful person by any means. A couple years ago, I struggled with my faith, but, really going through what I did really kind of made me understand how lucky I am to still be here.
Yeah. You know what this is making me think of, and I'm not sure if you've heard this episode yet, but there is a woman named Deborah who came on the podcast last year, and she spent time in the ICU. And she also has, I think she runs an ostomy support group in Canada.
Yep.
And in her journey, she had a near-death experience in the ICU, and she saw Jesus during her near-death experience. And so she had, like you, I think even a renewal of connection to her spiritual beliefs. So it's really making me think about that podcast, and it's making me think I want to introduce y'all to each other as well.
Yeah.
So I'm gonna.
Yeah. Actually, her podcast, it was one of the ones that I really resonated with, and it definitely really helped me because even though our stories aren't exactly the same,
Yeah.
how her story kind of went and how mine went, I felt very much seen when she was talking about her story in that part of the podcast. And I would love
Yeah.
to connect with her because she sounds amazing.
Yes. Yes. Yeah. My conversations with her, she is a really impressive person. It was great to get to know her a little bit, and I'll introduce y'all. Then the other thing that has really stood out to me is, and you've said this word a couple of times, is purpose. And I'm curious if you talk just a little bit more about how purpose has been like a big part of your recovery as well.
Yeah, it definitely has. I think going through everything that I have, my purpose I have not quite exactly figured it out quite yet, but I honestly would love to give back and help people. Like we've talked before, I do live in Columbus, which is a very large city, but we don't have a lot of support groups for different things. And I, of course, don't fit into just one category.
Yeah.
I would love the, chance to create a space for people who could come and ask questions and really relate to different situations with people that have been there. Not only with, I think, medical trauma and the way that things, happen to us, but I know what my parents went through and what my family went through and my husband went
Yeah.
through during that process and how it affected them.
Yeah. So you were talking about caregivers, the people who love you, who, while they're not the ones in the bed going through the intense, hard experience that you had, it can also be terrifying, and you feel so helpless to be the caregiver. I'm thinking of kind of the fear of losing somebody that you love so much and not being able to control that, and only being able to do what you can do, which is so important, right? That was so important. You've talked about that, how important it was that you had your family there every day in the ICU and there as you recovered, and there to say, hey, you need to go see a therapist, or being there for you when you're having a hard day. And the thing that I was thinking about is, how are they leaning on each other to be able to have that strength to keep showing up and being strength for you, especially in those really hard days?
Yeah, I think, like I said, the critical point, I don't remember a lot, but I've been able to really sit down with everyone in my circle and kind of, ask them to kind of fill in the pieces for me. And I've really learned that as traumatic as it was for me to experience what I did, it affected everybody around me. My brother and my parents and my husband, my best friend, my aunt. There was just so much that they experienced that thankfully I don't remember because I was, medicated at that time. But you can just tell, even to this day, I understand what I walked through, but I also understand what they have went through as people who love me.
Yeah.
They sacrificed a lot. They've seen a lot of things that, no one should ever have to see. And that is something that, I think has made everybody in my inner circle closer. We were
Yeah.
all very close to begin with, but after all this, we are, so incredibly close, and we spend a lot more time together and enjoy the fact that we are all still happy and healthy in here, and not to take those small things for granted.
I think that's really important, is the whole part about being a caregiver and really trying to stay strong for the person who is in just one of the hardest parts of their life. But it's also like, for your parents and your husband and your brother and your best friends, like, that was also such a hard time for them too. And I know so often the caregivers are like, well, I don't need anything.
Overlooked.
Yes, they're overlooked, and they're such a crucial part of it. And it's traumatizing for them too, not in the same way, but it is traumatizing, and caregivers are often overlooked. And so what I'm assuming is just that they were probably able to gather some strength from each other.
So my parents actually told me not too long ago, my 12th surgery, that was one of the major ones that I was going through. They had pretty much a waiting area where your loved ones could be, and my loved ones filled it. I had over 30, 35, 40 people in that small room. And of course, when Dr. Main came out, he came around the corner, and they said that you could just see the relief off his face, because he knew that he had did what he needed to. And so it was funny because he was giving everybody an update, and my brother literally told me this. He said that Dr. Main pulled up a chair and sat around a whole circle of everyone, obviously in my circle, and explained to them, that he had got everything that he needed to, and that my chances of survival were incredibly increased after the situation. But he sat in front of all of, my loved ones, and had to tell them exactly what's going on. You don't hear that every day. It brought everybody closer.
Yeah.
Everyone was leaning on one another, and people were there to support my husband. People were there to support my parents, my brother. They all kind of leaned on each other in a very traumatic and emotional time.
Yeah. Yeah. It's really beautiful, even amidst like the such a hard time where everybody was, really worried for you and your survival. And it just makes me think about being human,
Mm-hmm.
right? And like, as humans, we are going to go through challenging things, sometimes incredibly challenging things that, like you said earlier, you wouldn't wish on anyone else. But knowing that we are here in these bodies that can get sick and get injured, like, I think about like, what can we do? What do we have control over? And part of that is we can really lean into support, and support for ourselves, but also supporting other people. And that, to me, is one of like the most important things that we can do as humans, is to build support systems. And to be in a support system, you're also offering support to that system as well. And am so happy to hear your story of having so much of that.
Yeah. Like I said, am incredibly blessed in that scenario where I just have so many great people who have not only surrounded me when I got diagnosed, with multiple sclerosis and be chronically ill and what that trauma brings to the table, but
Yeah.
also in this scenario where I almost lost my life
Yeah.
and what that brings to the table, and for everyone around me to really understand that and support me has been one of the main reasons why I bounced back, as well as I did, because I did have all of these different resources and all of these people around me who, like I said, kept me accountable, but were also there when I needed them the most.
Yeah.
And, that's something that I could never, repay to all of them. I mean, they spent a lot of time. They filled my hospital room, on a daily basis, and even after, I came home and to this day. And that's just something that I'm incredibly lucky to have. I love them all to death, of course. But
Yeah.
the importance of a community and just really having people in your corner is a definite difference to healing. Probably, on the inside and the out. It definitely healed my mental health a lot faster.
Yes, absolutely. And I think, for people who are listening who don't have those support systems in place, there are ways that they can get support. I've talked about my community, it's called the Befriend Your Body community, because we have peer support, but we also have some nervous system education, and it's all about working to find safety in your own body after really challenging experiences like the one you're sharing. But there are also support groups. There are PICS support groups at some hospitals. There are support groups for specific illnesses in some places. And Danielle, that also leads me now to I know that you are feeling called to be of service to other people who are going through similar experiences. And so I'm wondering if there are ways that the listeners can get in contact with you.
Yeah, I mean, I have social media, D.B_Ford. That's my Instagram, or you can look me up on Facebook under Danielle Ford. I live in Columbus, Ohio. Yeah, my hope is to create a community where I can kind of get support groups together for various different situations, whether that's multiple sclerosis, ostomy support group.
Danielle, thank you so much for coming onto the podcast and sharing your story.
Thank you. I greatly appreciate the opportunity to kind of, give my side of things and be able to share awareness and hopefully help somebody.
Hearing your story is really moving, being able to listen to your story because you've been through so much and you shared the many ways that you've been supported through it and things that you've done to help you get to this point that you are now, where you're really wanting to help other people. So it was really beautiful. Thank you.
Thank you so much.
Thank you so much for joining me for this conversation today. If this episode resonated with you, I'd love for you to follow or subscribe to the Medical Trauma Support Podcast. It really helps more people find these stories and know that they're not alone. And if you're looking for a place to connect with others who understand what it's like to live with and heal from medical trauma, I invite you to check out the Befriend Your Body community. It's a supportive space where we explore somatic practices, nervous system education, and peer connection to help you feel safe in your body again. You can learn more and join us at medicaltraumasupport.com. Thank you for listening.